So my topic is the benefit of electronic health records in nursing. My name is Kara Brinkman. My thesis is that electronic health records in the healthcare field are more beneficial than they are harmful because they consolidate patient information. They allow for concise and direct communication between healthcare teams, and they also enhance patient safety because they do have alerts and safeguards to prevent or reduce medication and procedural errors. The first source that I reviewed was actually a quantitative study done in Athens, Greece, where they surveyed just a select group of the public as well as physicians because they wanted to see what both the public and the physicians thought about the electronic health records, and they wanted to identify drawbacks or concerns that both physicians and the public had, as well as benefits that both identified. And the public and the physicians did believe that the electronic healthcare record had more benefits than risk, but their primary concern was the possibility that third-party users could access their health information, as well as insurance and pharmaceutical companies. And they are also worried about the possibility of discrimination or stigma from the consolidation of their health history in one place and it being accessible to other users, such as the healthcare team. So the second piece that I looked at is an editorial piece that was written in the United States, and it discusses the role of nurses in electronic health information exchange, where nurses are using the electronic health records to communicate with a patient's primary care providers and hospital doctors just to make sure that information is being communicated clearly across all forms of care, and it talks about how important this information is to the quality and safety of patient care. The third source that I reviewed was a systematic review, and I chose this because even though a lot of the studies that were included in it span back to 2009, it actually was addressing the change in nursing with the implementation of electronic health records, and it discussed barriers that nurses were experiencing with the implementation of the electronic health records, and discusses the drawbacks of electronic health records. So I thought that it would be a good counter argument to my thesis. So the fourth source that I looked at was a quantitative survey of Canadian nurses, and it was just looking to see how their opinion of the electronic health records have changed since they've started using it more. And it did find that many nurses were more confident, and they found more benefits with electronic health records than when they had paper charts. It did mention some drawbacks of electronic health records that still remain, but those drawbacks were more in how the electronic healthcare records are made by others and not nurses versus the drawbacks of using electronic records. So my research plan for this paper is just to look at more nursing journals so I can find more nursing-specific articles and opinions and research regarding electronic healthcare records. I want to find more comprehensive information about the electronic healthcare records, as in like what does it contain and who all has access to it. I want to explore what the legal ramifications of electronic health record are, and I also want to do more research to find more recent and US-based articles that address the benefits and drawbacks of electronic healthcare record system. So the research questions that I would like to address for this paper are who decides when an electronic health record update should be made and what that update would entail, and are nurses involved in that process. I would also like to find and research more of the main benefits and potential safety risks for the patient of the electronic health record, who has access to that information, who all has implemented electronic health records, and then how has it benefited and impacted the patient's ease of access in obtaining their medical records, and then the overall improvement of patient care since we've transitioned from paper charts to electronic charts. And these are my references, and that's my project proposal. Thank you.